Well, hip arthroscopy is a minimally invasive procedure where we're typically taking care of issues inside the hip that aren't arthritic issues. The patient is positioned on a special table that allows the surgeon to get access to the hip joint by pulling distraction. We enter the hip through a combination of small incisions and identify the hip lining called the capsule. A capsulotomy, or a cut through the capsule, is made to allow us access to the hip. It helps if we place traction sutures through the tissue to aid in visualization. The number of traction sutures are dependent upon the size of the cut. Mainly we're dealing with structures called a torn labrum, people that are having pain with associated mechanical symptoms or sometimes just pain, where we're going in a minimally invasive technique through several small incisions and using that to repair the tissue instead of doing a formal open procedure like a total hip arthroplasty or hip replacement. That allows us to approach the hip and clean up any debris, scar, or inflammatory tissue to allow us access to the torn structures. Once we've identified the torn structure, we have an instrument called a burr that allows us to remove any bony overhang that might be contributing to the problem. Once we've done that, we access the rim of tissue. We place something called a suture anchor or a Q-fix into the bony rim of the socket of the joint. Once the suture anchor is placed and secured, we have a device that allows us to take that suture and pass it around the area of the tear. And then once we pass the suture, we will tie it. The number of suture anchors placed depends on the size of the tear. The candidates of this procedure are people that have experienced hip pain. Typically, it's in the front or the groin of the hip. Sometimes it's on the side, sometimes it's in the back. We go through a physical exam, and those that are appropriate after that, we try a diagnostic and therapeutic injection into the hip to see if we can get them feel better, but also to localize the source of the pain or pathology. And once we've done that, if everything else has failed, then we approach the hip arthroscopy. Once we're done, if that's the only pathology present in the hip, we will repair the capsule. In other cases, there's associated injuries or problems that we have to address. Many of these are bony prominences that are contributing to the labral tear. We access the area of bony prominence and use a device called a burr to resect any bony excess that is causing pain and or labral pathology. Once we're done, we will repair the tissue that was incised at the beginning of the procedure to help restore stability to the hip. Typically, they're gaining a pain-free hip, full motion, full strength, and the ability to return to normal activities, including any and all athletic endeavors.